All right, welcome to this explainer, prepared specifically for all of you targeting the CSS and PMS Current and Pakistan Affairs 2027 exams. I'm your instructor, Zohaib Ahmed Anjum. Today, we're doing a deep dive into the hard data straight from the Health and Nutrition chapter of the Economic Survey of Pakistan 2024-25. Now, for any serious aspirant, this document is your absolute baseline, right? It's literally the definitive diagnostic report of the country. But we're not just going to sit here and read numbers off a page today. We are going to critically analyze what these specific data points actually mean for the state's structural governance. Getting a grip on the real-world implications of these stats is exactly how you're going to craft those high-scoring analytical answers for your exams. So let's jump right into the data.
So let's kick things off by asking ourselves a pretty foundational question. How is public health actually connected to the systemic shifts the government targets in its fiscal policies? Well, the truth is, you simply cannot separate a nation's health from its economic trajectory. They go hand in hand. The Economic Survey makes this crystal clear. A high disease burden acts as a massive anchor, dragging down our national GDP and putting a severe strain on the state exchequer. Think about it. When preventable diseases are running rampant, workforce productivity just completely plummets. On top of that, the data shows how crazy high out-of-pocket health expenditures are actively pushing millions of vulnerable citizens below the poverty line every single year. Grasping this undeniable link between biological well-being and macroeconomic stability is absolutely crucial for mastering this topic.
Now, think of Pakistan's public health infrastructure as this massive, deeply interconnected web. The data tells us this network is huge. We're talking thousands of basic health units, hundreds of rural health centers, those massive tertiary care hospitals in the big urban centers, and of course the incredibly vital grassroots lady health worker programs. But here is the catch. To really understand the data, we have to look past just the sheer volume of these facilities and analyze their actual capacity. The survey points out a huge disconnect. The physical brick-and-mortar structures exist, sure, but a lot of the rural nodes in this network are dealing with chronic absenteeism of medical staff or just severe shortages of basic medicines. And it's a domino effect. If one crucial part of the web fails, like primary care in rural areas, the entire tertiary system in the cities gets overwhelmed and just buckles under the pressure.
When the Economic Survey zooms in specifically on nutrition, honestly, it paints one of the most concerning pictures for our country's future. We are looking at historical stunting rates among children under 5 hovering right around 40%. Let that sink in, 40%. Add to that critical levels of wasting and severe micronutrient deficiencies. For a CSS aspirant, the analysis here is what matters. What do these numbers actually mean in the real world? Well, it means a massive chunk of our future human capital is facing permanently compromised cognitive and physical development. Before a government can even dream of pulling off broad industrial advancements, IT revolutions, or massive infrastructure corridors, it has to fix this human capital deficit. You just can't build a modern competitive economy on a foundation of severe childhood malnutrition.
Okay, let's talk money, because that's the baseline metric supporting this whole system. Historically, Pakistan's expenditure on health has seriously struggled to inch past the 1% of GDP mark. Barely 1%. When you look at the 2024-25 fiscal allocations, you have to ask yourself what that tiny percentage means for our society. It falls way short of international standards and World Health Organization recommendations. And because this baseline expenditure is persistently low, our healthcare system is basically forced into a perpetually reactive mode. We're constantly scrambling, playing whack-a-mole with acute crises, viral outbreaks, and emergencies, instead of having the fiscal breathing room to actually build resilient, proactive, and preventative care networks. This GDP allocation is really the ultimate reality check on our national development goals.
And that brings us directly to the government's push for targeted policy reforms, exactly as outlined in the survey. The document is pushing for specific, aggressive interventions, not just passive, everyday maintenance. We are talking about intensified national immunization drives, upgraded maternal and child health programs, and literally integrating nutritional interventions directly into primary education. The directive is unmistakable here. The state has to actively work to eliminate these persistent health burdens. But for your exam prep, you have to look at the implementation mechanisms. It is not just about bumping up the budget slightly this fiscal year, it's about forcing through structural reforms to ensure that money actually bypasses all the bureaucratic bottlenecks and gets down to the grassroots level where these health crises are actually happening.
You see, when the survey talks about necessary policy reform, it is calling out deep-rooted structural failures. Take the doctor-to-patient ratio, for instance, or the massive disparity in healthcare quality between urban centers and rural peripheries. Superficial adjustments, like, just buying a few more hospital beds for Islamabad or Lahore, that doesn't fix the systemic failure. True policy reform represents a severe structural overhaul. We're talking about decentralizing healthcare management, creating aggressive financial incentives so specialized doctors actually want to serve in rural postings, and digitizing supply chains to completely eradicate the theft and pilferage of government-supplied medicines. It requires fundamentally rewriting the rules of the sector, not just slapping a Band-Aid on a broken system.
So what exact systemic barriers does the government need to completely eliminate according to the data? Well, the survey targets the eradication of highly specific, debilitating issues. It aims to wipe out localized outbreaks of diseases like polio, which, let's be real, severely isolates Pakistan on the global stage. It targets the completely unacceptable maternal mortality rates in underdeveloped districts. And crucially, from a purely economic standpoint, these policies have to eliminate the massive out-of-pocket healthcare costs. Right now, out-of-pocket costs make up more than half of the total health expenditure in the country, over 50%. If the government can't eliminate that financial barrier, universal health access is nothing more than a nice idea on paper.
The bottom line is you simply cannot fix a massive, complex structural problem with a blunt, unfocused instrument. You need targeted, precision interventions. And the Economic Survey highlights exactly this kind of focused reform through initiatives like the Sehat Sahulat program and targeted universal health coverage schemes. Instead of just blindly pouring money into a leaky bucket, targeted reform means setting up highly specific, ring-fenced budgets for things like maternal nutrition programs to cut off the cycle of stunting right at the source. It means figuring out the exact geographical pockets where immunization rates are dropping below safe levels and deploying highly concentrated resources straight to those exact districts. Effective policy requires precision, plain and simple.
Bringing all this data together gives us a really holistic view of what the 2024-25 health budget is actually trying to achieve. On one side of the equation, we have this incredibly chaotic web of current challenges: 40% stunting rates, a meager 1% GDP health expenditure, and severe infrastructure disparities. But on the other side, we have the incredibly sharp, focused fiscal policies and targeted interventions that are required to actually fix them. The journey laid out in the Economic Survey is all about transitioning from a fragile, reactive, underfunded network into a highly resilient system that genuinely protects and builds our human capital. As future policymakers, your job is to understand exactly how the state plans to bridge that massive gap.
As you continue your deep dive into Pakistan affairs for 2027, I want to leave you with this final critical thought to chew on. Really look at the numbers we've discussed today from the Economic Survey of Pakistan 2024-25. Do the current budget allocations and proposed policy targets actually match the immense scale of the crisis? Will these fiscal policies truly eliminate the root causes of 40% stunting and those massive out-of-pocket expenditures? Or are they merely cosmetic adjustments that just reshape how the problems look on paper? That right there is the ultimate critical thinking challenge you have to be ready to tackle in your exams. Keep analyzing those hard statistics and always demand clarity from the data. Good luck with your prep.